When looking for orthopedic care, the number one thing a patient should be looking for is the experience of the surgeon and a surgeon who cares.
I think we all have a very personal connection to our patients.
Here at Orthopedic Specialists of Southwest Florida, we pride ourselves on getting our patients back to their activities of daily living, their quality of life, and the things that they enjoy most.
At Orthopedic Specialists of Southwest Florida, you can find a large group of fellowship-trained, experienced surgeons, as well as everything else you'll need for your orthopedic care all under one roof.
Here at Orthopedic Specialists, we really have taken on a multidisciplinary approach to taking care of patients. I think that it starts really when we see patients in the office and establish a plan of care, and whether that would be non-operative treatment or operative treatment. And if we do decide to proceed with surgery, I think it's obviously very important to involve not only the patient, but their families. The family is going to be a very important part of the patient's success after a surgical procedure. Additionally, it's also important to involve the patient's other caregivers, including their primary care doctors and other medical specialists. I think that's how, long-term we get the best results. We avoid complications and really, again, get people that optimal outcome that they're looking for.
I think in our practice we have a very wide spectrum of specialties, which I think allows us to really hone in and focus on very specific type of treatments. I think if you have someone that does the same thing day in and day out, they've been in practice for a while here, they have a strong referral pattern, and they have excellent outcomes. In this community, that reputation goes a long way, and I think that Orthopedic Specialists prides ourselves on providing that care and hiring those type of physicians and bringing them to the community. When we find an area in the community that is lacking in care, for example, whether it be initially trauma surgery or advanced joint replacement or spine surgeons, we seek and we find the physicians that could fill those voids, and we bring them in here, so we are always at the cutting edge of care and providing the care that the community needs.
I think a really important part of our being an orthopedic doctor and being a doctor is to really guide the patients, to be an educator on it. So the more information we can give them about the experience, how the experience will be, the better and more comfortable they're going to feel at the end. So it's good to know what you can expect, okay? What the possibilities are after the surgery, how's your recovery, what is the expected recovery. And I think if you educate the patients, that's going to help to really on the recovery time, be more proactive on the recovery time on the physical therapy point. So really the education is a really important phase for us in our practice.
When I talked to Dr. Guzman, he made me feel very comfortable and made me feel like he was really looking out for my best interest, because I told him I did yoga, I told him I played pickleball, and he recommended the SuperPath method because that way it's less chance of my hip dislocating when I'm doing these exercises, and also the recovery. I told him I wanted to recover. That was my main goal, is just to get back to normal because I was in so much pain. And so I felt very good about my decision to go with Dr. Guzman. I trusted his opinion, and I felt like he knew what he was talking about, and obviously he did.
As a person, they asked about me, they asked about what my goals were, they asked what I was doing, and they talked me through that process of beginning to become active again. They were very, very clear in what I could do and what I should be doing, so that I was able to push myself, knowing with their care what I could do to get myself back. And it was a total team effort, and quite frankly, the most pleasant experience I've ever had in a medical setting.
When we're managing someone with various maladies, illnesses, the predominant thing they usually have is pain and loss of function. We work here as a group to try and manage both. My primary job as a physician is to try and help their pain. To help their pain, you have to understand the underlying condition. Is it a pinched nerve? Is it a muscle pain? Is it spasm? Is it nerve pain? Sometimes it can be bony pain. Sometimes it can be tumor infection pain. You have to be aware of all scenarios, and they're all treated differently.
It's critical that when a patient comes in with a problem, that we do our best to try to explain the diagnosis to them. And I think what's very unique is not only do the physicians at our facility try to explain the diagnosis and explain what's going on to the patient. But our physician's assistants have years of experience. In my opinion, we have the best physician's assistants and medical assistants in the community, and they are also up to date and up to speed with the diagnoses, and can also help as a team explain to the patient what the diagnosis is and how they're going to work through the conservative and or surgical problem to get to a stage where they can go back to their regular activities, go back to the things that they enjoy, get back to their regular walk of life.
We also have vertically integrated services here, physical therapy, MRI, X-ray, as well as a state-of-the-art surgery center right next door to our building.
And we can see really the impact that we have on those patients. Some patients have been denied surgery from some other physicians because either are high risk or have so many complications. We have the option here at orthopedic specialists to take care of those problems and take them to the most challenging cases.
So when we started in 2000, we wanted to be that cutting edge practice, that cutting edge facility and practice. But at the same time, we wanted to have that small office feel. We wanted people to be comfortable, to know who was treating them, to know that their concerns were going to be addressed. And as we've grown, it's in some ways become tougher, but at the same time, it's still one of our core values that we are your hometown orthopedist in a state-of-the-art, cutting-edge practice.
The doctor's orthopedic practice, this is where the routine problems come to be handled in the best way possible, and where the tough problems that can't be dealt with anywhere else are being addressed.
Lee County has grown exponentially, and so has orthopedic specialists to meet the needs of the county. We've just opened a beautiful 60,000 square foot state-of-the-art facility. And right across the parking lot, we've opened a 20,000 square foot state-of-the-art surgery center and outpatient center. And I can truly tell you that each and every provider that we've added has brought significant value, not only in their skill and expertise, as everybody here is fellowship trained, but also in the personal care that they provide.
Fort Myers, Florida is my hometown, and as such, I take a lot of pride in taking care of people and the community where I was raised. And I certainly wanted to end up in the best orthopedic practice possible, and this is without question, hands down, the best fit.
And not only am I proud of where I live and the friendships and the relationships I've developed here, I'm very proud to be a member of this practice. What makes me most proud is that unequivocally I would receive care from anybody in this practice, and it's a place that I would go to personally to have my orthopedic care done.
Our goal here at Orthopedic Specialists of Southwest Florida is to get you moving and back to being happy and healthy.
At Orthopedic Specialists of Southwest Florida, we have all the care that you need under one roof.
And this proves our commitment to Lee County and Southwest Florida that we're going to do our best to take care of every single person.